Hello, good evening, and how are you? How you day? Welcome to another session of Ask the Doctors. Now, the program holds every Sunday by 8 p.m. West African time. My name na Frederick Unubohai, or my name is Frederick Unubohai. How are you, and where are you watching me from? Now, on this program, we are here. We take questions, we teach, we speak with people. And on today's session, we'll be taking question and answers. I'm the host of the program. My co-host is Dr. Israel, and he'll be joining us very soon. So before I start, can you tell me where are you watching me from? Good evening. So where are you watching me from? Tell me. We are live on Facebook. We are live on YouTube. Yes, tell me. Is Babe? Good evening. Destiny. Destiny, good evening. How are you? Okay. So we're taking questions tonight. Hopefully, we'll be able to respond to you. But please know that we don't prescribe medications here. We don't treat. We don't make diagnosis. In case you are here and you are looking for medication on this platform, sorry, we would not prescribe any medicines for you. Jiraya, good evening. How are you? Laurencia, how you day? Yeah, good evening. I'm watching from Ibadan. Okay. We have somebody watching from Nigeria. Can you hear me now? You can hear me. Just say yes, I can hear you. If you can hear me, just like yes, I can hear you. Know that you hear me. Okay. Good evening, Manodu. Good evening. Good evening. Good evening. Good evening. Watching from yes. So we have Prince. Prince is watching us from Indonesia. Yes, I can hear you. Destiny from Abuja. Elizabeth. Good evening. Manuel Du. Yes, I see you. Rachel. One day guy. This your name, eh? One day guy. How far? Okay. So if you have any questions for us tonight, please drop your questions in the comment section, and by the grace of God, we'll try our best to respond to you. Okay, I can hear you. Nice, nice, nice. Okay. So talk to me. Ask your questions. Please share this live session. Please share. Everybody click on the share button and invite your friends. Huh? Yes, very important. Okay. Watching from where? Good evening, Dr. Fred. Tina, good evening. Watching from Lagos. Doctor, how are you? Thank you. I did fine. Perpetual Jude. Okay, it's Friday, and this program holds every Friday. Sorry, I said Friday. Sorry, my God. It's Sunday, and the program holds every Sunday by 8 p.m. Every Sunday here. I have somebody watching me. It's breaking. Is it breaking? Watching from where? Hi, Isabelle Matthew. Hello. I see you. Good evening. Good evening. I'm watching from where? Anambra. How are you doing? I'm doing very well. I did okay. I did can't wait. Okay. So this program, we did teach on the program. We answer questions. We teach. Last week we spoke about diabetes. Yes, diabetes. So today we have decided to take some of your questions. Please drop your questions here. No private chats. I don't do private chats on social media. Do you understand? Or give me your number. I want to call you. I'm sorry. I don't give out number on social media. This is why we have this platform. This is why we have the platform. Juliet, how are you? Good evening. Yes. To respond to you, Jeriah say, I just the wait for waiting. I just the wait for this session, like say now waiting. For real? Okay, let's see this question here. Very good question. Please, is it possible to be pregnant but scan and blood test can't see it? Okay, so it's Babe. Is that your name? Abibi. So let me say something, I beg. At the very early stage of pregnancy, at the very early stage, let's say 2 weeks, 3 weeks, you might do a scan and you might not find anything. Anything. So most times we will tell the woman to repeat her test maybe in the next 2 or 3 weeks. Do you understand? So at the very early stage, you might not pick it, especially if you have someone who is not very skillful in doing this scan. You understand? You might not pick anything. But when the pregnancy has gotten up to 8 weeks and above, scan will pick it. Pregnancy test will pick it. I know why you are asking me, because there are some women, they will tell them that these women, oh, that you get belle, scan no go see your belle, and your pikin dey hide. It's a lie. There is nowhere a woman will be pregnant and scan will not pick the pregnancy. 2 months, 3 months, 4 months, 5 months, 6 months, it's a lie. Scan will pick it. Now, the people that do these things that tell you that, madam, you are 5 months pregnant, you are 6 months pregnant, scan will not pick it, and the baby is hidden. The baby is hiding, the special baby. Those people want to chop your money. They are criminals. Yes, I said it. They are criminals. Those people. Those people. But at the very early stage, you might not pick it. But when the pregnancy has gone very far, you will surely pick it. Huh? Good evening, Juliet Imwetia. Ijoma, how are you? So please, if you are here and you are looking for any medicine for us to prescribe for you, sorry, we will not prescribe medicine for you. We will not treat you. And we always advise you, if you have any problem, any medical challenge, please go and see your doctor. This platform is majorly for education. Huh? Good. Dr. Israel, how you doing?
Very fine. Happy New Year. Yeah, that's all day.
Your network is breaking. I can't hear you.
Happy Sunday.
Happy Sunday. So I hope we'll be able to hear you tonight. Please, sir, all the hair hold in my body is looking like eczema all over my body. I don't know what to do, sir. Please, what can I do? So first of all, your name is Ediono. So your question is not clear to me, Dr. Israel. I don't know if you understand this.
All the hair in the body like eczema.
Your network is breaking. Your network is breaking.
Can I make that clear?
It's still breaking. But I know you can hear me, but from your
Yeah,
I know you. Yeah, I know. Yes, Dr. Fred, how is so Dr. Israel is breaking out. I don't know why it's breaking. I'm serious. I don't know why the network is breaking from your end. So people in the comment section, please let us know. Let's see, Dr. Israel's comment, even yours, mine is breaking too. Okay. So let's be sure that we are all on the same page. Oh yeah, say something, Dr. Israel.
Okay. For that person, Did I mean that? Okay, for that, I think you need to see a dermatologist.
It's breaking, it's breaking, it's breaking, it's breaking.
Okay, let me look at
Okay. How is my network? Is it breaking? Let's see. The boats. Okay. I don't know what's happening tonight. Let me see if I can do this. Let's try. Yeah. Somebody says mine is very clear. Okay. My Dr. Fred's transmission is very clear. Emmanuel Augustine. Okay. Thank you. A bit. Yeah. So mine is very clear. Now, the person that is asking us questions concerning your hair, you said your hair is something like eczema. I'm looking for your comment again. I would advise you to go see a dermatologist, though. You understand? Because your body is looking like eczema all over your body. You need to see a doctor. Your name is what? Your name is Ediono. Okay. You need to see a dermatologist so that they can examine you and then tell you what to do, what to apply. Do you understand? What medications? If there's a test you would carry out, they will tell you, and then what to give to you. There is no way we can prescribe anything for you. I don't even know what is wrong with you. First of all, I have no idea. You understand? Yeah, I think the best thing for you to do, Ediono, to speak with your doctor and most likely see a dermatologist. Huh? Doctor, is cucumber fruit or vegetable? My dear, eat cucumber, whether it's fruit or vegetable. As long as you eat cucumber, that is the most important thing. Unless you are writing an exam. If you're writing an exam, then this your question is relevant. What does it change? What does it change? Are you going for an exam that you want to know if it's a fruit or vegetable? You understand? See, there are some things that are irrelevant. Eat cucumber if you can. Eat oranges, eat watermelon, eat garden egg, anyone. If you're writing an exam, okay, fine. We'll classify it under vegetable. If you're not writing an exam, anywhere you can classify it, no problem. As long as you eat your cucumber or any other thing you want to eat. Sure you get. So let's stop paying too much attention on these things that will not affect our health. What does it do for our health? Eat, my dear, anyone you can. Yeah. Please, I need a medical advice for you. What's your name? This is your name. Why are you having this kind name on my page? I don't want them to flag this thing. Or what be your name, my guy? Please, I'm having my girlfriend is having some issues. She has been pregnant 2 times now, and the two go out as a result of miscarriage. So you know, get name. So I don't know how I want to call you or address you. But what I think you need to do, make your girlfriend go see doctor now. Make your girlfriend go see her doctor, most likely an obstetrician. But obstetrician, a woman will get belly. So go say a gynecologist. Make she go see her doctor. Make them check and find out why she dey lose the belly. Do you understand? It is very important. Now, if she don't lose the belly the first time, the second time, there's a very high tendency say that belle, the third one, will also come out. I'm not saying now prophecy, but there's a high tendency. So waiting, I go advise you now, may your girlfriend go see her doctor. Make them check am. You get okay, good, welcome. Make them check am more because there are many things that can cause marriage. Many things, many things. It might be maybe she has a medical challenge, or she get problem with her uterus or her cervix. So many things. Please, I do drink water a lot, 4 to 5 liters a day, but I pee little. but at night I would be waking up to pee constantly. Please, is it normal? So reduce the amount of water you take towards in the evening. Destiny. Reduce the amount of water you take in the evening so that you will not be waking up to urinate at night frequently. Do you understand? So if you know that you take water, I don't know what you do. I don't know the kind of job you do. I don't know where you live. Maybe you need too much water in your system. You need more. uh So if you know that you urinate often at night, reduce the amounts. First of all, that's the best and the first advice online. And if you reduce the amount of water you take towards in the evening, and yet you still urinate often, frequently at night, see a doctor. You get very, very important. Okay. Alpha, can you hear me?
Yeah, can you
Hello.
hear me?
Yeah, your network is very clear now. Okay. So we have a comment here. It says, Doctor, please, my son, about 2 years and 5 months, and he can't talk normal. Okay, Israel, what would you advise this person?
Okay, 2 years and 5 months. It depends on what you say, they fit talk well. It depends on the things because not be every picking within that age go fit talk so many things clearly. However, if you think say even the simple words when you supposed to talk, the fit talk and clear, you carry the picking go see pediatrician, make them look the tongue if there's any problem, so that if there's a problem, they can actually solve it for you.
Okay, yeah, thank you. If you are just coming, welcome. So we are taking questions and answer tonight. We're taking your questions. If you have any questions for us, please drop it in the comment section. But remember, we won't prescribe any medicine for you here. Okay. So we have a comment here. Oh God, let me take this one. There's one comment here. I'm trying to go. It says, okay, this one says, please, doctor, I'm feeling pain in my left side of my stomach. What can cause it?
If you get pain for the left side of your stomach, so many things go fit cause am. Everything within the left side of your belly fit cause pain for that side. Eh? Your stomach itself, where food dey enter, fit make pain dey there. Your kidney fit make pain dey there. Your pancreas, if problem dey, e fit make pain dey there. Your spleen, if you get problem with your spleen, e fit still make pain dey there. So anything wey dey that left side part fit make you get pain for your belle. So the best thing as you dey get that pain, if the pain dey very severe, see doctor, make dem do scan for you, make dem look inside the belle and see wetin really dey cause the pain. So with that, they will be able to know what to do.
Yeah, yeah. Okay, let's take the next question here. Please, doctor, my sister had stopped menstruating for the past 7 to 8 years now, and she is about 40 to 42 years of age. Hmm.
Okay, the question would be, as at that 7 to 8 years when you stop menstruating, wetin una do for am? So now that one be the first question, because now it's already 40 to 42. It means it already they go close to close to that time when you suppose just stop not to dey see am again. That's menopause. So wetin una do for am then go determine anything, if there's anything to do for am now. And another thing, why is it very important now? Because if you don't give birth to children finish, if you not get any reason, anything where you really need, there's no need thinking about it's not a problem. Because when you know they see your monthly whatever, you don't mean say now bad blood now not great come up for your body. Because I know say most people they think say once you not see your medicines, it means say the bad blood in your body not come out. Not be true. So the thing now, if you think say it very disturbing, see a gynecologist, that is doctor when they specialize in treating women. See them, they go want do some investigation for you, and if it is very important, give you medication if it's very important. But if it's not the important, they will also let you know what and what you should do.
Yes, welcome. If you just come today, we dey take questions and answer. Today's session now questions, huh? But again, always remember we no go prescribe any medicine for anybody on this platform. You understand? Okay, clever. My name is Clever. Clever. Okay. For those who don't know, Clever sent a question before. Talk say in girlfriend get belle 2 times and she don't lose the belle 2 times. So waiting, I tell you, I want to come again. When a woman lose pregnancy the first time, some women go dey lucky, they go just get belle again. It go happen, they go get belle, they go born. But if she can't lose the belle the second time, there's a high tendency say she will lose the belle again. So waiting we dey like tell people when this kind of thing happen, no before your girlfriend to sit down for house. Wetin you go do as the man, support her, follow her, go hospital. Make she see a gynecologist. They go check her, find out wetin happen, wetin dey her body, wetin dey do her. Oh, when this thing dey happen, if they need to do test, they go do test for her. You understand? That is the best thing we go give you here. No be for her to go buy any medicine, drink. Oh, do you understand? I beg. That is the advice. Make she see a doctor quickly. Make them check her. Okay, we get question here. Doctor, Isioma dey ask, please, can ulcer be cured?
Yeah, the answer is yes. Ulcer can be cured. It depends on where the ulcer dey. What be ulcer? Ulcer na wound. Just no say ulcer na wound. So ulcer can actually be cured. So if it be say na, I know the ulcer when you dey talk now, the peptic ulcer. Yes, it is very difficult for that one to heal finish, but actually it can actually be healed, it can actually be cured. So it just depends on what you do. So sometimes you need to let go of some things. So when you let go of those things, after some long period and you take your medication as prescribed, after some time, it will really cure. It's just that one of the problem where we get is that the way when they're supposed to treat ulcer, not be a drug when you go take for 2 days or 3 days or 1 week. You're supposed to take them for a long period of time before it will really come cure. But sometimes because most people when they take out 2 days, 1 week, they not they feel the pain again, they not they feel anything, they go stop. And there are different things when they cause ulcer. So you need to know what it cause your ulcer so that you will treat based on that. And so when you treat based on that, yes, you can actually be able to cure it.
Okay, make I add something also very important. I dey hear a lot of people say I get ulcer. I dey treat, they go. Please, you get so many other sicknesses wey fit look like ulcer. So if you know say ulcer dey disturb you too much and you get money, you can afford to do an endoscopy. Abeg, try do endoscopy. Make we dey sure true if na ulcer you get or na something else you get. Do you understand? Because a lot of people go just wake up, talk say I go do scan or I do H pylori test, therefore I get ulcer, and e dey there. So if you know say they give you medicine, you dey drink, it still disturb you, and you can afford to do an endoscopy, please see your doctor. Make dem do endoscopy for you. Make we confirm true if na ulcer. And then wetin Dr. Israel talk also, the medications, no be wetin you go just take for like 2 or 3 days, you go disappear. Sometimes you need to take am for a long time, you understand? And avoid any other things wey go trigger your ulcer. Finally, I don do video 2 about ulcer. The video dey YouTube, the video dey Facebook. Try watch am. Everything wey we talk for here, e dey there, and some other things. Okay, so we have another question here from Courage. Courage says, doctor, please, at what month should the baby start standing on the lap? Because my baby will be 5 months by Tuesday, and she's yet to stand on my lap when I carry her. Yes, go.
Okay. So that one I cannot remember if that one joined the milestone, the normal milestone for children. But yes, and when you put your baby for lap, now you the support am to even stand. So you not go just stand well. He go sometimes put one leg for ground, raise the other hand up, because he really never understand what you they try to do for him. And sometimes he wants sit down. It now depends on how your baby they like to, what he go like, what they like to do at every month. So it not mean say he get one problem or there's a particular month when that baby must stand for your lap. So if your baby, as at the 5 months, you don't teach her how to sit down, those are normal things where we go they think about. If the baby not do those ones, we feel the thought say, okay, maybe there's a problem. But if by 5 months, 6 months, you don't teach her to sit down, you don't try sit down well, there's no problem. So and not to worry your pikin say they stand for your lap. Now see baby he be. And he go stand for your lap when the time comes.
Dr. Israel, your video is frozen. I don't know why your video they frozen. Yeah, you know move. I don't know why. Try fix them. Let's see. Okay. This person says, please, how can I get the doctor you call? Help me with the contact so can call you. I don't understand, please. Sorry. What was your name? Edionu. I'm sorry. I don't understand. Many comments there, so I don't forget. Okay. We have a question here. It says, hello, doctor. Hi, Godzi Rich Ben. How long can you wait before trying for another child after a cesarean section? The person in question is above 40 years. This question gets a lot of things involved. Number one, the age of the patient is above 40 years. Number two, the doctor will do CS, they will tell the woman, understand? Most times when the woman do cesarean section, times the minimum na 2 years. Make sure you wait minimum 2 years so that the wound will heal well. Do you understand? So after you do cesarean section, they say make the woman wait minimum 2 years. This woman is above 40 years. I'm not a gynecologist, I'm not an obstetrician, but this woman would need more specialized care because of her age. When woman did her age and above, and some other things they involved. So she will need to have more interaction with her doctor, so that may them check her, tell her, find out if she will need to take any medicine too in the period, because she might want to get pregnant again, and may they assist her at that age. Because from 35 years and above, when a woman reach 35 and above, the chance say she go dey carry belle immediately, quick, like when she dey younger, it reduce. No be say she not be carry belle, but it don't reduce. So she will need more interaction with her doctor. Her doctor. Okay, we have a question here. It says, "Good evening from Wise Mice. I have a 4 years old son, but recently had a missed miscarriage. I was told the baby stopped growing at 7 weeks. And after that, my body gets swollen just like that. So what did they do for you? It got swollen? Because if you had a miscarriage, sorry about your miscarriage, sorry, yeah. But when you say your body got swollen after miscarriage, they're supposed to do something for you. So I don't understand your question. So you get, like, if your body was swollen after miscarriage, is it because of the miscarriage or something related to the miscarriage or outside miscarriage? They're supposed to find out for you and check. But I don't think there's I don't know if it's linked to the miscarriage. You understand? Yeah. We have a question here. It says, is it possible to get pregnant at age 54? Dr. Israel, what do you want to say about this?
And the answer is yes, it's possible. Hope you hear me.
Yes, go ahead.
Yes, it is possible to get pregnant at age 54 because there are many ways to become pregnant. One, even at 54, some persons still they see their menses. So if you still they see their menses, there's possibility say you go fit get pregnant. Then apart from that, there, as I said, there are other means. IVF fit come to play for there. So if the person do IVF, if you still get pregnant, so there's every possibility that somebody can be pregnant at age 54. It is possible, it not be something will be magic. Even at age 60 sef, person fit still get belle use with the help of IVF. So it is possible. Dr.
Okay,
Fred,
this comment, yes, this comment says, what about left upper back pain? What about it? I don't understand. What about left upper back pain? What about it? Moving train. What about it? Your question. Doctor, if something is screwing in the body and having rashes, what is wrong? Dr. Israel, please want to respond to this from Ibrahim.
if something is screwing in the body and well, I don't understand that. Is it screwing in the body? I don't understand. I don't understand that. But if you is having rashes and you will need to go see your doctor, may they see what they cause the rashes and if there's anything they want to give to you, so that may they forgive you.
Okay. Doctor, please, do we have food that when we consume too much of it, it might likely affect the eyes?
The thing is that too much of everything they say is bad, so you don't really need to consume anything too much, because anything when you consume can actually too much can actually affect one part of the body or not. Now remember, say when we talk about taking of garri, we say when you drink too many garri, it will affect the eyes. But we get to know, say not be because you drink the garri, and because of the process of how they take make the garri, because of one acid when they said where they did the garri, if it's not well processed and you can't take on too much, if it can't affect the eyes. So it is better that everything you take, every food wey you take am in a moderate form, so that make it not affect any part of your body.
And if there is any food that you would not want to eat, you would limit all those your processed food. You understand? Processed foods, your junk foods, you will have to limit them because not just about the eyes, but they can affect every other part of your body. And like when they affect your heart, they cause you problems with the heart. It can also indirectly affect the eyes. You understand? There's some food you give you high salt intake and the rest cause you high cholesterol, high blood pressure, and the rest can also affect the eyes. So we want to avoid those food and eat more of our natural food. Okay, we have a question here. Before we continue, please share this video, share this live, share everybody. Share. Good evening. Please, is it possible for a woman to give birth every year, like 3 babies in 3 years?
Okay, Dr. Fred, are you there?
Go ahead.
And it's not like it's not possible for a woman to give birth to a child every year, but it is not healthy. It's not healthy for that woman to give birth to a child every year. And sometimes if the woman after delivery they see a period immediately, then this thing fit happen, say go born almost every year. But note, it is not healthy for the mother and for the child, not just the unborn child, but the child when e don first born before e come born again, because those children go get so many malnutrition or malnutrition problem, and the mama herself no go dey very fit to fit take care of these children. So depression, psychological issue and all that go set in. Even the uterus go dey even the womb where pikin dey stay go even get problem because of the stress when you don't carry and pass within that period. So even though it's possible, but it is not healthy for both the mother and the pikin.
It's risky. That's the word. It's risky for the life of the woman and her baby. We have a comment here. It says, "Doctor, but is it normal to pee little by the day? I work in a hot drink and wine shop. Seriously stressful, and I do take water too much when I'm supposed to pee a lot to avoid kidney stones. So, is it normal to pee little by the day? If you work in a hot environment and you drink water, your body will take that water because your body needs it. That is why you are not even peeing. You understand? So, most likely, the water you are even taking might not even be enough for your body. That is why maybe you are not even peeing like that a lot, because according to your question, where you are working is hot, maybe you should be sweating more. So the water you are drinking, you might even be sweating those ones out and then drinking more water. Basically, that is what I feel because of the kind of job you do. But other than that, if you know you take a large amount of water according to your own estimation and you are not even urinating at all, take out time to go for checkup. Let them check you and be sure that everything's okay. Before we continue again, people are not sharing the live. Share. Let your friends come and see. So we have a question here. It says, "Doctor, please, what causes frequent low potassium?"
Okay, if you not eat food wey contain potassium, you may likely have that. And sometimes some even when there's problem with the kidney, you can have that. However, if you think you have low potassium, please go and see your doctor. It will be the best person to tell you what is causing it, and give you the best treatment for yeah. Because I don't know how you think no say you get low potassium, but whatever it is, go and see your doctor. It will be the one to tell you what and what you need to know.
Yeah, my concern with this question too is the word frequent low potassium. Why are you using that word frequent low? Who is requesting for this potassium? If it's a doctor, they should be able to find out why and tell you what to do. No individual will just go and be doing potassium tests up and down frequent. No, you understand? There's something wrong somewhere. So if it's a doctor that is requesting for your potassium, they should be able to tell you why and prescribe if there is a need for you to be on potassium medications, you understand, and they will give to you. But you should have a doctor managing you. Potassium is not something that is like paracetamol we discuss anyhow. It's a very powerful compound. Please, very, very powerful, trust me. Okay, we have a question here. It says, "Doctor, please, I did is that fibroid surgery 3 months ago. Period came out after 3 months, since on the 19th up till now, still coming out."
Okay, when something like that they happen, since 19th till now, so you need to go see your doctor again. May they re-examine you. And most of the time, when the period they come back again, they come back in a high form and all that. Sometimes it they happen this way. But when you think it don't the trouble you, you need to go see your doctor because the hormone they try to recover, they try to rearrange themselves. So you need to see your doctor. And I believe so when you do the fibroid surgery, they carry that that waiting they bring come out, go do histology. So if they carry and go do histology, you suppose know waiting be the result of that histology. That one go see help and guide you to know what they really saw during the fibroid operation. So you need to go see your gynecologist again. I hope you know gynecologist now do the surgery. You need to go see him again, make it tell you what and what to do because of that bleeding.
Moving train is just Moving train. What about left upper back? What about left upper back? I don't understand you. Moving train. What about left upper back pain? What about left upper back? Anybody can have pain at any part of the body. What about it? Somebody's asking us a question here. It says, doctor, can I try vaginal delivery after one cesarean section? I took in after 15 months. Israel.
Okay. Most of the time, we they say after one cesarean section, if you take in after 2 years, 2 to 3 years, then it is safer to try vaginal delivery. But your own is a year and some months. Now it go come depend on wetin your doctor, the kind of cesarean section wey you do, and wetin your doctor see. Now go fit tell you wetin you go do. Yes, it is possible that say you go fit try, but they no go assist you in any way. And once there is a little delay when e suppose come and they go tell you make you go do CS again. So one, your baby no need you, as far as you don take in, you need to watch the size, the weight of your baby, because if your baby weight big, pass a particular kg, you na cesarean section, and the doctor fit tell you say it will be. But you need to work hand in hand with your doctor so that they go fit tell you the best route of delivering for your baby. So not go fatal, not say abeg, even though now it must be vaginal delivery, this other one, no, not fatal. Just get ready for whatever your doctor will tell you. So as I earlier said, if like say now 2 to 3 years, we go say it is safer to try. Not be say you must, it's not a must, but it's to try. So even with your 15 months, yeah, you depend on the hospital and depend on your doctor. He may want to still give you that slim chance to try. But anything when you see before you reach 9 months, now go make am know whether yes, he go give you or no, he not go give.
And if I fit add again, if your doctor tell you say e no dey safe for you to do vaginal delivery, no go listen to people for road or for church. You understand? Or religious homes wey go tell you say forget, the doctor no know wetin dey talk. Go this place, go do vaginal delivery. Like Dr. Israel talk, they go assess you. If they feel say e dey safe, it's possible they go down. If they feel say no dey safe, they go tell you. If you no listen to your doctor, some things can't happen, madam. Now you go suffer am because the rest people go run leave you. You understand? So please, yes, some women fit try based on your doctor's assessment. If you feel say you know this safe for you, please follow your doctor's advice. If you say make una try, try. Your doctor wey dey manage you, na him be the best person to give you that advice. I beg you. Wetin dey important to us now, make the mama dey okay and make the pikin dey okay. The two of them dey fine. That is the most important thing. Yeah. Okay, this person says the swelling came few months after the miscarriage. So what do you now do after the miscarriage now? After the swelling came, did you go to the hospital? You had a swelling after miscarriage. So what did you do? What did you do? And that is important. Okay, this person says, I mean, I'm having left upper back pain during the daytime. Dr. Israel, you want to respond to this?
So if you're having back pain during the daytime, the question now, what kind of work do you do? Do you carry heavy load? If you carry heavy load, there's every tendency to say you could get back pain. How do you sit? If you sit for a long time, how do you sit? Do you sit like you want to relax, or you sit straight? Because you're supposed to be sitting straight on a chair in a 90 degrees to reduce any back pain. But if you're not sitting like that, you're just sitting in any form, like a relaxing form, there's every tendency to say you will get those kind of back pain. And also the bed where you dey sleep, is it a orthopedic bed or semi-orthopedic, or the foam when you say once you enter you go inside? So it still depends on that. that can also lead to your back pain. And then if that back pain they do you, is there other part of the body that is paining you? Is there another part? Was there a trauma to that place? So these are so many questions that your doctor will want to find out before they will even tell you what and what you will do to reduce that pain or to stop the pain. Is the pain disturbing your daily activities? So all these questions not be me, you not go fit answer am here. Even though you answer am here, we not go tell you, if you just give us idea of some things, but it not mean say we will come tell you, say go do this, go do that. So the best answer to your question is when you are able, if you get answer to all these questions, talk to your medical doctor and he will tell you what and what next to do.
Okay. When one is feeling as if something is walking on the body and having rashes, what is the cause?
Now it gets some things when I ask us what is the cause, we not go fit pinpoint anything. Because like this kind of question now, they have other many questions that when they go ask you, before they go even know what they really they happen. So one of the things now, we want to find out your blood sugar. Then one thing when person go want find out. We want to find out your BP. We want to find out some other issues concerning yourself. We want to find out where you they sleep. The bed, how long you they change your bed spread. How often you they get all these body rashes and something they crawl for your body. So you get many things when they go ask. So if you get all these things and they are disturbing you, I will also as first advise the other person, see your doctor so that may you follow and talk so that he go fit tell you what and what you need to do so that all those rashes and all those things where they work out for your body fit stop.
Okay, before we continue again, if you just come, we take question and answer tonight. This program na 8 p.m. every Sunday, and today's session na question and answer. We go soon end the session, but before we end, we try to take a few questions again. Share this video, invite your friends. Thank you. We have a question here. Doctor, please, what can one do when the sugar is very low, like 50? Because I have an 82-year-old here. His sugar is going up and down.
So when person sugar they go up and down, not be waiting you want the treat for house. This is an waiting you need a specialist, endocrinologist to manage that person case. The first thing you need to know that person when sugar they go up and down, you see that person is diabetic and they take some medication where they make that sugar they go down. And then you go do one thing, you go see and go up. So when you say the sugar they go up and down, you need to see a specialist endocrinologist. So people where they specialize in treating sugar matter, where they specialize in treating sugar matter. So now that person I go tell you what and what to do to make sure say the sugar not they go down and the sugar not they too go, they too go up. Now when you see say the person that they get sugar level of 50, for the main time, as far as you know say the sugar don't they low, so that we go advise you just give a cube of sugar, make that person a leak, make it just boost up the sugar small. Or you think give Coke or all those sweetening drinks, just small. Obviously, you go pack and give them a drink small, so that make it just boost up the sugar. So by after you do that, I beg carry this person go hospital, see the specialist, make them for fit make sure say the sugar not they go up and down again. So you go fit dey one place.
You heard the advice. Doctor, let's see, please, after giving birth, how long does a woman supposed to wait before she get pregnant again?
So if we really dey follow wetin WHO talk, make we do in terms of breastfeeding, in terms of giving your pikin milk from the body make it take, you go see say WHO say even to stop na almost 2 years. So if na by 2 years now you need to stop your pikin from that, So I think that one is a way to answer your question. So it's a way to answer your question. Why they talk like that? So that you go see time to make sure say your body heal perfectly. And apart from healing perfectly, that bonding between you and that your pikin when you get go don already dey there before you go get ready to carry another one. So 2 years minimum is okay. So if you fit stay more than that, no problem. At least your pikin and you go don dey bond and your body go don heal perfectly.
Okay, we're almost out of time. Can one have up to 4 cesarean sections?
The answer is yes. Somebody can even have up to 5 sef. However, the more cesarean section you dey get, the more you dey put risk for your womb wey dey carry the pikin. And the more you see dey put risk for your life as well. And why I talk that risk for your life is because once the womb don weak and anything happen to the womb, e fit lead to a lot of blood loss, and that one fit cause problem to the person. So yes, people can, but for this economy wey we even dey, giving birth to 4 children, come be say na CS you wan use for those 4 children, you need to still think about it. And I dey talk about mostly people wey dey Nigeria. You need to still think about not just Nigeria, wey dey a developing country. Let me use that word, developing country. You need to still think about it. So to help yourself and every other part of your body, please, 4 cesarean sessions, even though it is possible, I think it's also too much.
Yeah, I feel 4 is also too much. I feel so. It's possible, but it's too much on the woman. You understand? It's very possible. It has happened. Good evening, please. When someone having pain in the lower abdomen and noticed stone inside, what is the cause? Thanks.
Okay. You see, when we dey read your question, we do our face one kind. When we hear say you say the person notice stone inside, we don't really know how you notice the stone. But if you feel that you notice when you touch the belly, you notice something, it shows say na time for. It shows say you suppose dey hospital, see your doctor, make them really know wetin that thing wey you think say you notice be, and they go know what next to do for you. So whatever's not supposed to any part of your body and you notice that thing for that part of your body, go hospital. It's not right. Say you notice even swelling in any part of your body when not supposed to be there, you suppose go hospital. Make them know wetin be this swelling and what can this swelling cause to my life, so that make them for know how they go take treat am and make you for see dey safe from such swelling. So for you, when they get low abdominal pain and you can't notice stone or let me say swelling for inside, abeg go hospital, make dem do scan for you and also know which kind of stone you notice for inside your belly.
Yes, if you notice, we no fit diagnose anybody on social media. You understand? If not, so you just come see your problem. No be so you dey work. So according to wetin Dr. Israel talk, your doctor go need to know more. True, if na stone dey there, if na stone, okay. If no be stone, they will find out wetin dey cause your pain. Shey you get? Who dey even do the test for you to help you know? Abi na you just carry your body go do test? These are very, very important stuff. Okay, as we prepare to round up tonight, good evening, doctor. I'm treating prolactin for some time now. I have used, okay, up to 9 cup, but the prolactin level is still high. What will I do, please?
The question when I go throw back to you is, who give you all these many things where you don't use? You know, some of us, I know some people will be say when they don't go read, they go come see name of so many drugs. They go come go they buy and they use. All these drugs, they also get side effects. And sometimes you buy some drug, you not take on the right prescription, e no go work for you. Even though you use like 1 million drug and you not take the right prescription, how e supposed to be taken, e no go work for you. And also, you need to, the last thing when I go talk on this, because I not believe saying that doctor now go don't give you all this many drug when you don't use, and when you don't use like 9 cup, and the doctor not can think of any other thing for you to do. So that's it. So because I not believe in that, I will say advise you, the doctor who you need to see now gynecologist. So see a gynecologist, I go tell you what the best thing for you to do. And I bet when you reach them, make sure that you let her know all these medications when you don't take, so that make it for know the best line of management for you.
Very important, because a lot of women say they get high prolactin. They will just wake up, do tests, get high prolactin, but that prolactin itself no be they even give them issues. You understand? Because some women don't
They
fit
not they
carry
do
belly
test.
and the rest.
Most of them not they do test. Dr. Fred, most of them not they do test too. They just press something and something come out and I get they'll come go browse. Say why this thing happen. They come see for this is saying prolactin.
Or I don't see one or two stuff. So some people for comment section will talk, say, I get this problem. Now this medicine I use. Somebody will say, which medicine be that? Tell me the name. You can't tell them. People go by. I understand that we all need to be fine, but all these things get processes. So that means you know go overtake waiting you know supposed to take safe. The 9 cups is too much. Why? You get final questions for tonight. Final question. Let's see. Please, sometime I feel some light abdominal pain. Sometimes it's as if it is breathing. What does it?
Dr. Fred, answer this one.
Okay. From time to time, everybody they feel slight abdominal pain. No human being we never get slight abdominal pain. You could just get that pain, you go disappear. Your belly fit just move one time. You understand? Maybe you get what you chop, your belly go make one kind noise, or you feel your belly hook you. It happens. The only person we no get pain, maybe na person we know they exist. One or two, if you get one small, it will disappear. But this your abdominal pain. If you notice say this pain, it don't day there. Though it day light, but it don't day for a long time. It's abnormal. Get it checked. Don't no go buy antibiotics drink you get, because most times women they sabi get lower, some kind slight lower abdominal pain wey go dey there for a long time. So we need to find out wetin dey cause am. Na problem with the pelvis, or been a problem for the colon, so many things. You get the point. I don't want to mention anything here. Me no want to talk something that you get. But if you dey get that kind of pain, you go need to, in most times, if you don't take for you, carry out 1 or 2 tests, and then know wetin dey cause am, and then know wetin to prescribe for you. That is the only way we can know wetin dey do you. But if you know say the pain just starts maybe 2 days ago, just do you small disappear, never panic now, because you understand. But if you know say you get belle, or you get some other stuff wey dey do you and then pain dey there, abeg go see your doctor. But if na only abdominal pain, light, just come and go. Abeg, relax, no too panic. Shey you get? Yes. Somebody says 2 weeks now you didn't answer my question. No, 2 weeks, we didn't see your question. No, questions plenty for you. Fine. Okay, Mo, do this one because of time. It's almost time to end. Doctor, fasting blood sugar that is 7.2. Does it mean the person is diabetic? 7.2. 7.2. Ma, see wetin it be for milligrams per DL. 7.2. That is 129. That is quite high. If that's the fasting, that's quite high. I'm not going to pronounce anybody diabetic on top of social media. I'm not going to make any diagnosis for anybody on social media. Now, only when we have a one-on-one consultation, we fit talk that one with our full chest. But that value, they higher than the normal. You don't even pass the where with the say person they diabetic 126. So you don't pass, which is questionable. So we made this person quickly go see in doctor, make them reconfirm again and find out what they go do. But for this program, that value they high pass normal. But to give the person diagnosis for here, no. We not go give you diagnosis because we not be your doctor and we not get any doctor-patient relationship. So you understand? Yes. Dr. Israel. So as we round up tonight, make I say something again for those who just they come, no vex. This program now every Sunday by 8 p.m. West African time. Today now question and answer. Next Sunday, if it be topic, this is how we come online every Sunday to respond to few questions. We have guests sometimes, and then we also teach on the program. So in case you came late, no vex, you can join us again next Sunday. So Israel, any final words from you?
Okay, what I get to say is to say happy International Men's Day to all the men for this place. And so this session, I think we just dedicate it to all men. It's not easy to be man, so for all men, happy International Men's Day. And also to let everybody know, say it is very good to take care of your mental health. So in one way or the other, try take care of your mental health. If you notice anything that disturb you, and not say me not think about the thing, but don't worry about the thing. There's a difference between thinking and getting worried about it. So when you get worried about things, it becomes a problem. But when you think about them, it means say you try to look for solution eh, to that thing. So please try and take care of your mental health. It is very, very important.
You don't hear, everybody protect your mental health. Happy International Men's Day to all the men all over the world watching us. We say Happy International Men's Day to all the women when they look us, they listen to us, and you get man for your life. Wish the man Happy International Men's Day. I know they easy for this present day generation to be a man if you follow a love. So I think it's great we celebrate all the men. Thank you so much for joining us. Thank you for watching. Thank you for spending your data on this platform. We don't take it for granted. If we no answer your question, I beg no vex. When I come online, maybe during the week, if I get a chance, I will come online. We go try. No vex. Thank you once again. Help us share this video, share this live. Like I'm always tell you, good life now waiting. Good life. Nah sense. Take care and bye bye. Bye bye, everybody.